how the dental environment would be, what she would expect. Like she would have to get on the dental chair, the magic reclining chair.
The magic chair. Hi everyone, welcome to another episode of The Bite Angle. We are from Dental Designs Clinic in Singapore. I'm Dr. Erin, and this is my colleague and oral health therapist, Raudhah. Okay, so today we're here to discuss the role of the dentist and oral health therapist in kids dentistry. So just by way of introduction, I really enjoy seeing kids at the clinic because I used to work with kids quite a fair bit when I was working at a children's hospital and actually at the primary and secondary schools.
Oh, that's exciting. Actually, I do enjoy seeing kids as well. During my training time at Health Promotion Board, we've been seeing a lot of kids. They are from primary school, so I've seen a fair bit of them as well during my training days.
Yeah. Around what age group
actually they're not that young. Maybe around the youngest, I think probably 6 years, 6.5, going to primary school. But I'm keen to see more kids younger than that. That'd be great.
Yeah. So kids are very different from adults, right? Just from the way that they act and behave when they come into the clinic, and also to their teeth itself, like their development, what's going on. It's all quite different, and it changes a lot, right? From when they're toddler age all the way to when they're teenagers. So I think today we will kind of talk a little bit on what we should be looking out for, or how we kind of assess the situation also when we see kids. I think, the biggest, let's start from the beginning. So when should a kid first see a dentist or an oral health therapist? I think usually by the age of 1. So once they start having even their first tooth, maybe they should start by seeing a dentist for checkup. Yeah.
Yes, I agree. Because once they have their first tooth, they still have to take care of it all the way until they get all their permanent teeth. So the first step to getting being disciplined in good oral health starts with the first baby teeth. And then it transcends onwards to the adult teeth as well, good oral hygiene and habits.
Yeah, exactly. And even their gum health. So usually what I tell parents is actually even before they have their first tooth, they can try to make sure that they wipe the gums with like a gauze or a rubber brush. Have you seen those rubber brushes?
Yeah, I've seen that. And actually, I've used it for my baby as well.
Yeah?
So even though we don't see teeth there, there's actually bacteria because they are eating fermentable carbohydrates like milk. Although all these milks has carbohydrate, sugar, and even the snacks they eat, there's whatever that comes into their mouth can will cause the bacteria to accumulate in the mouth. So getting rid of the bacteria by using a small silicone toothbrush or even a soft gauze can actually remove the bacteria and keep the mouth healthy.
Yeah, from the tongue also and from the gums.
Right?
From
the tongue and gums.
And I think that also, like you mentioned, the bacteria population in the mouth already starts to accumulate once there's any kind of sugar. So it's quite good to try and keep the bacteria population healthy and low so that they don't get issues easily once they actually start having teeth. And I also find that, you can tell me because you're a mom, I'm not. Do you think that it helps them get used to someone moving around in their mouth? So they get used to the idea that, we're going in to clean. Do you think that helps?
Yeah, I think that will help at the young age. That feeling that they have to make it a routine to get their mouth clean. Yeah, at the early age would definitely helps a lot in the long run.
Yeah. How do you feel about how we can help kids prepare for their first visit to the dentist? How do you prepare your kids actually when they first had to see a dentist?
That's a very interesting question. My kid hadn't have the first tooth yet, but once she has, I'll definitely start to read and explain to her what the dentist would look like, how the dental environment would be, what she would expect. Like she would have to get on the dental chair, the magic reclining chair.
The magic chair.
And then she have to open her mouth like a lion, as big as possible. And then there's a small mirror coming in to check all her teeth. Yeah.
Yeah. Often also there's a lot of content out there that prepares kids. Like there are cartoons that show how a visit to a dentist looks like, things like that. Do you think those are helpful?
Yeah, definitely. Exposure to all these very friendly, dental friendly videos definitely make them feel more welcome to the dental clinic.
Yeah, because they know what's going on, right? Yeah, I think also I do like to tell parents not to make their kids feel like they're seeing a doctor, or basically, a doctor, but more of that, hey, we have teeth and we want to make sure our teeth are nice and pretty, so we're going to see the dentist who will just help us make our teeth nice, So it's not like I don't want them to feel that it's like a checkup.
Scary.
Yeah, exactly. It's just something that will help them and hopefully make them feel good.
Yeah.
Yeah. But yeah, every kid is quite different. Some kids are a bit more agreeable in temperament. They get used to the environment quite fast. Some kids are a lot more nervous around new things, especially if they had, I think, bad experiences or traumatic experience at any healthcare setting. I've had some kids come in after they just got a vaccination and things like that, and they get quite nervous. So when we see a kid come in for the first time, do you have any tips or go-to tips that you do to try and make them feel welcome or at ease?
Oh, yeah. Definitely, yep. We don't know where or what the experience the kid has before. So usually before they enter the dental clinic, I already ask them, oh, how are you? How's your brushing? Oh, actually before that I would already would ask them, how's your oral hygiene? Do you brush your teeth twice a day? Make them feel a bit less scared, or maybe we just ask a random question like, what do you eat just now? Make them feel comfortable. Maybe not straight to the teeth part.
Yeah, I agree. Yeah, sometimes when I start to talk about the teeth, I like to ask, oh, so what color is your toothbrush, or what color is your toothpaste? Do you know if your toothpaste has a flavor? And I just see what they say. Sometimes they say really funny things. Yeah, I think I had a kid just yesterday who was, a few days ago, I think, who said, I asked him what flavor his toothpaste was, and he said, he just said, oh, it's pink flavor. So what flavor is pink? He said, I don't. And kids love to go I don't know.
Yeah,
right?
I think some of them are chatty. Some of them could be a bit quiet, but we won't push them. But make them feel comfortable is what is the first step to getting them to be comfortable on the chair as well.
Yeah. Yeah, I also always think about the first visit as like an introduction for them to the dentist and the clinic. I usually do tell parents that today we just want to get them used to the clinic and used to the chair, the tools. So I introduce things like the magic moving chair, the little sun. I call it a sun, the little light. Turn on the sun, turn off the sun.
So very bright.
And the little water gun we use. What I like to do is a technique where we call tell, show, do, which is like to tell them what we're doing and then show it to them somewhere else. Like I like to show it on the fingers. Like I would use the air spray and I'll spray on their fingers, or even the polishing cup, I'll polish their fingernails first.
Yeah, I do that. I used to do that too.
Yeah, and then only if they're really comfortable, then in the mouth. Yeah, so honestly, I don't think we need to start doing treatment or cleaning on the first time we see a kid. What do you think?
Yeah, I think we don't really have to push to treatment right away. When they see the things that we're using, if they know it's safe, it's nothing sharp, like we test on their nails, they feel it's soft, gentle, then they will feel better. Then maybe we can do treatments that maybe less tiring, like cleaning, or if their teeth is not that dirty, we could actually go straight to how they can brush and improve their brushing and proper technique.
Yeah, I think that's super important, and I think for that point, that's why I think that's why oral hygiene therapists are oral health therapists, are very very instrumental to kids dentistry, because a lot of it comes down to oral hygiene. Like we want to make sure that kids have good oral hygiene habits and maintenance before problems even come in, right?
Yeah.
So I think you're right. Giving like really good oral hygiene instruction is an important part. I like to do like toothbrushing exercises with them sometimes, especially if they already have a toothbrush with them, or just tell parents to bring it. It's always a good idea to bring along a toothbrush on the first visit, I think, because that's like the majority of the time that the kids spend, right, which is at home with their parents. They only see us once every half a year.
Yep.
Yeah, and if their teeth are not clean every day, then it's that's where all the problems come. Do you do any toothbrushing exercises with kids? You mentioned you do, right?
Yeah, I usually will. I think we do prepare a toothbrush model, the typodon, and then a toothbrush. Then we can demonstrate to the kid how we can improve and the correct technique to brush the teeth, improve their brushing on areas where they're not brushing well after we've seen the teeth.
So yeah, there's also this agent that we call like a plaque disclosing agent. Basically, it's a dye that we put onto the teeth and the gums, and the areas that are cleaner are different color from the areas that are dirtier. And then usually for both kids and adults, like after you use it, they rinse and then they can see in the mirror where the dirty spots are. Do you do that for kids, or have you tried it before?
Haven't really tried that on kids yet. Maybe due to short time, but that is a very powerful tool to show kids where exactly the areas they missed up. Really, I want to try that for my kids as well one day.
Yeah, it's quite. I do it for some of the kids I see who I think after the initial part where they get used to the clinic, it's quite fun because kids are very visual learners, right? They are probably not able to understand fully sometimes when we tell them things like, oh, there are germs or worms in your mouth. They can't.
They can't. They can't see.
Yeah, but when they can see their teeth are all like covered by the purple dye, then they're like, oh.
And they were like, oh, I gotta brush my teeth.
Yeah. How do you feel about? For kids, brushing is very important, right? We know that. How do you feel about like manual brushes or electric brushes for children? What do you tell parents if they ask you?
Yeah, it depends also on the dexterity of the kid. If they're and their current oral hygiene, if they're already brushing with manual toothbrush quite well, and could do just minor improvement, then we'll continue with the manual toothbrush. But if their teeth are, some kids maybe their adult teeth is come out crowded, rotated, then I would definitely advise them to use the electric toothbrush. It will really help to aid the brushing.
Yeah, I think that's good advice, because I think that it's not like one of them is necessarily better than the other. You're right. If their teeth are already quite clean and they like the manual toothbrush, then it's great to continue with whatever they're doing if it's working, right? But yeah, I think electric toothbrushes, like you said, I think can be a great option, especially for slightly older kids, right? Once they have the adult teeth come in. And nowadays there's a lot of types of brushes on the market, and some of them are specially for kids.
I think there's those meant for younger kids.
Yeah.
I think they can have a try. Those who would like to try could try those, and then there's also some timer and lights. It's like very attractive. They will definitely use that to brush their teeth.
They even have a lot of them. Some of them, not all of them, come with a link to a smartphone app. So
I heard that too.
Sync up, and I think
Yeah, I heard that about it.
Yeah, I saw one brand that has a mascot, like a mascot on the app, like a cartoon mascot. So if they're doing a good job at brushing, then the mascot will be like, "Oh, well done." And if there's anything that's not so good, like they're brushing for too quickly and something like that, they will report it also. It's quite an easy way for parents also to see how their kids are doing. I often find that kids like to model after their older siblings or their parents. So I have had some kids I've seen who switched to an electric toothbrush because they saw that their older sibling or their mom or dad is using one.
Oh yeah, that's great.
And they want to try it also. So sometimes if I advise parents to try and switch, I would tell them like, hey, if you're using one, let them play with it. Let them see how it feels on their fingers. And then maybe they might be like, oh, mom has one. I also want one.
Oh yeah, definitely want to have a try as well.
Yeah.
Because they're curious. What's that?
Yeah. How do you feel about flossing for kids? Do you advise that regularly or like depending on the situation?
For flossing, yeah, I think definitely once they get their, not just the adult teeth, actually baby teeth too, they have to do a little bit of flossing, maybe with the help of the parents, to remove the bacteria or food getting stuck in between the teeth, because it can be uncomfortable for them. Also, overall oral health, it will be much cleaner for their teeth. If they remove the bacteria stuck in between the teeth, even baby teeth. And this will also help to prevent decay on the baby teeth as well, because we don't want the food and bacteria stuck there or to accumulate and cause decay on the teeth. Yeah, starting early is better than starting too late in the adult teeth. Then maybe it could prevent further decay on the adult teeth as well.
A lot of parents do find it quite, when I tell them like, oh, maybe you should try and introduce flossing, they're like, oh, how can I do it? Their mouth is so small, I can't fit a floss in. From your experience, do you get that? And what do you say in response? I usually suggest floss picks because nowadays there's like all the colourful ones. But I do understand that even floss picks might be a little bit challenging.
Actually, floss pick is good idea to get the parents to help the kids with the flossing. Actually, that is wonderful because if you use the string, some parents are not very good at doing it.
Yeah,
and
it's super hard.
Yeah, it's super hard. And yeah, I think the floss pick would be perfect for kids for the start when they want to learn how to floss on their baby teeth as well.
Yeah, I think there's no easy solution. Sometimes if the kid is quite difficult to brush for and then furthermore even floss for, sometimes I tell parents to just try with like the front teeth first. Slowly get them used to it. But
Good, definitely. Front teeth first, slowly progress to the back teeth. Then definitely, if for the younger kids, need the guidance of their parents. Also, parents have to monitor how their kids are brushing the teeth. Because some of the kids they're not really good at brushing. So if the parents monitor brushing, they can help to see which areas they missed out.
Yeah, definitely. Actually, the tip that I learned during my training is that for children, they should not be brushing independently. So basically, they should have someone supervising or helping them until they're at least 6 or 7. And one tip I heard is also that they should only be brushing by themselves when they can tie a shoelace.
Oh yeah. I think their hands, fingers, the manual dexterity, they're not getting used to the floss or even the holding a brush properly. If maybe they can end up like braiding the gums or something if they're not using it or holding it properly. So they need to be always supervised.
Yeah. Speaking of kids a little bit older, okay, let's talk about kids a little bit older. Let's move away from the toddler age. What do you look out for once kids start to reach maybe the age of like 6, 7, when things are starting to change a little bit?
7. For kids reaching about 6, 7. Oh yes, definitely the first adult tooth, first adult molar tooth start erupting by then, and then usually we would monitor if the permanent molars is it growing, erupting around that time, or maybe if it's not erupted yet, then maybe we could monitor a bit, maybe another 1 or 2 years, see if it's going to erupt soon, and then we would see how their oral hygiene is. Also for the first adult molar that comes out, we want to prevent decay from happening on the teeth as much as possible. Keep it clean, and sometimes for deeper growths, we do advise parents that they have to put a fissure sealant so that it can prevent and protect the teeth from decay.
Yeah.
What do you think?
Yeah, I agree with everything you said. Yeah, so oral health therapists like yourself can place fissure sealants for kids, right?
Yep.
Yeah. Yeah, so regular checkups, whether it's with a dentist or oral health therapist at that age, can be very useful for catching early problems.
Yeah, dentists can do the fissure sealant as well, not just oral health therapists. So if they could do fissure sealants, and especially for deeper growth, seal it up, then maybe this teeth is protected against decay.
Yeah, I think what you mentioned about monitoring for development is quite important as well, not just at 6, 7, but through the whole process when they're changing teeth all the way until they're like 13 years old and all that, right? So regular reviews first, and then usually when I see a child where tooth supposed to be erupting already around that age but has not yet come out, I get advice that okay, hey, let's keep an eye on it. But if it drags on for too long, like more than a year, 2 years, then we do want to take x-rays usually to check what's happening under the surface. Yeah, so parents sometimes have questions when we take x-rays, but I always do explain to them that it is necessary and why it's necessary at those points in time. Yeah, and actually if they are seeing a dentist or oral health therapist quite regularly, then we might have a better understanding of what's been going on, and that actually might help us to decide at what point they need the x-ray, if that makes sense. If I'm seeing a kid quite regularly and I know that on my last time I saw them, they still have that baby tooth and it's a bit shaky, and then I see them 6 months later and mom is like, oh, the baby tooth dropped out but the new one hasn't come in, then I can feel more confident to say, oh mom, it just came out in the last 6 months, so don't worry, the adult tooth is still just taking its time to come out maybe, we can watch again, But if they don't have such regular proper intervals, I feel a bit more uncertain about what the situation has been so far. And for kids, there's so much going on, like there's so many things getting shaky, dropping out here and there, that sometimes it's quite hard for the parents and also the kid to keep track of by themselves. I think that's why it is quite important for kids to be monitored during this teeth changing phase. And I also find that during the teeth changing phase, the oral hygiene tends to be a little bit poorer because it's harder to brush. There's like so many loose things in the mouth.
Loose teeth that need to... Yeah, it's good to get them reviewed every 6 months as well. Then with maybe they have a provider, doesn't matter, it's oral health therapist or dentist, who can see the changes of their teeth. And they can, other than monitor for their tooth changes, they could also monitor the oral hygiene as well.
Yeah. I also find that usually at that age is around when kids start going to school and have access to the school canteen, and then that's when the snacking becomes a bit more out of control. Before then, like sometimes the parents are very diligent, they can monitor exactly what snacks you're having, but once they go to the school canteen, it's like they can buy their Milo, they can buy their snacks. I do find sometimes around that age group the oral hygiene goes down a little bit. I think it's quite important to try and correct it early, because the new adult teeth, like you mentioned, once they start to accumulate more bacteria, it's at risk of having decay. Yeah, and I do always tell kids, like, hey, you know, your new teeth, they're really nice and strong, but you gotta keep them until your mom's age. You know, you gotta have them all the way until your mom's age. You're not gonna get a new set already. This is like this is the last set. You know, this is the last chance. And if you want to have nice teeth when your mom's age, we gotta start keeping them clean now. Yeah. When it comes to kids getting a bit older, do you feel like when you see them, the way you clean for them changes, or how would you go about it?
As they get older. You mean cleaning wise, or when they see their 6 monthly checkup, or
Maybe cleaning wise, like when you see them for appointment, how does it change from if you saw them like when they were in kindergarten?
definitely a lot more adult teeth are out. Then we are more. I think we will keep an eye for decays and gum health as well. So I'll be starting to monitor. Okay, if there's any decay, and we can because for oral health therapists we are able to do feeding for kids 18 and below. Then if there's a decay, then we would try to catch it early and get the restoration feeding done as soon as possible before it gets too big or go too close to the nerve. And then we also cleaning wise, definitely will be doing a cleaning. Just that there's more teeth other than slightly longer duration for cleaning. We'll also be getting them to start using the floss and reinforce the brushing technique, as well as getting to know their dietary habits as well. Yeah, I think cleaning wise, we need to get them to start brushing twice a day and the proper technique to help remove the plaque accumulation and prevent decay and gum disease overall.
Yeah. Oh my gosh, yes. Actually, so often I do see kids at schooling age, and I ask them how many times are you brushing your teeth a day, and they say they go really quiet. Then they go, sometimes twice. I say sometimes twice. Then when do you skip sometimes? And then they go, oh, morning. I say why? Because I have to wake up very early for school. I'm too tired to brush in the morning. So yeah, I think they're definitely at the age where they need to take charge of their own oral health better. So I try to explain to them like, hey, you know, after you sleep at night, all the bacteria has time to accumulate. Like, do you want to go to school if you go to school without brushing, sometimes, you know, your breath might smell bad, or your teeth are gonna start becoming a bit dirty and yellower. Like, you know, when you smile, it might not look so nice. Like, do you want that? And I try to explain to them why. I also, around that age also, sometimes I start to use the ultrasonic scaler actually, because I find that for kids, if the gum health is not good, they can have the same gum problems as adults because they essentially have the same teeth. I've seen some kids with really bad gingivitis, have very bad gum inflammation from quite a young age, like even 8 or 9, because the accumulation of the dental tartar is already there, same as like adults. So I basically treat them like adult teeth, and if they need scaling, I would actually start to scale for them, but at a lower, gentler setting, so that they can try to get used to it. Yeah,
I totally agree.
Keep clear of the gums so that we can clean off without causing discomfort. And especially the older kids, once they start to get braces or like Invisalign down, the oral hygiene once again goes down a bit.
Maybe they not too sure how to maintain good oral hygiene with the braces or Invisalign. I think maybe a lack of dental knowledge or something. And that's where we, like dentists and oral health therapists, even hygienists, comes to advise them, reinforce the brushing technique. 6 monthly checkup, if there's any decay, or cleaning wise, we need to do the cleaning for them, gentle with the ultrasonic scaler, gently around the teeth, get them used to the feeling of and vibration, as well as the water lingering in the mouth.
Yeah, exactly. And I find that sometimes when some kids they start doing braces or Invisalign, they start to neglect the regular oral hygiene appointments. I think it's very important for parents. I guess also it's the dentist's responsibility to try and remind. So it's good also when you have the support system in the same clinic. So you have the dentist who's performing the braces treatment, and maybe also an oral health therapist who's available, or another general dentist, to make sure that the kid is still being seen every 6 months instead of having the treatment in different places. Sometimes they miss out on appointments because they are already going to one dentist for braces, and then they forget that they need to go to see their regular dentist for oral health maintenance. Yeah. Well, besides that,
Yeah, I think the oral health for the older kids, as they maybe some of them had their braces early, so if they have poor oral hygiene habits, then food can accumulate even more faster because there's wires all over their teeth. Yeah. So they must see their hygienist or dentist for cleaning every 6 months.
how do you feel about recommending like X-rays? Do you recommend X-rays to kids actually? And do you feel comfortable recommending X-rays to kids?
Is case by case basis. Usually X-rays we do that only if it's necessary, right?
Yeah.
Then we try to avoid the need for that, unless need to check for decay that's we can't see. It's hidden, and sometimes you want to see how far deep the decay has gone into the tooth. That's where the X-rays come very handy, because we don't want to. We want to diagnose. We don't want to just give a rough idea. Oh, this one have decay. We need to give a full view of the whole mouth as well. Which exactly the decays are. Sometimes it's just not one decay. It's, the whole mouth. There's a few decays. So yeah, the X-ray will help to detect everything in one image. We can see the whole thing, from the image taken from the X-ray. For more higher risk, decay risk kids.
Yeah, that's true. Yeah, you're right about the caries risk. I always find that if I see one cavity in a kid, I definitely would want to take X-rays because there's a good chance that there's going to be another one, even if it's not obvious yet, like a beginning sign of decay. And I think that, kids, sometimes the decay can progress quite fast because their oral hygiene might not be so good, or they're not so aware, or they might have unhealthier snacking habits. I agree with you. I usually recommend X-rays when necessary, and I explain to parents exactly why, because you can't see under the surface and we want to check for other kinds of cavities. Yeah. Well, do you have any oral health tips or any other advice you might want to give to parents that we haven't already mentioned? I think we mentioned quite a lot of things.
What else? What else could parents do to? Yeah, I think parents at home play a crucial role to remind the kids to brush maybe twice a day and get their kids familiarized with the dental setting. And so the kids will come as well to the dental clinic and get their teeth checked. Because sometimes their teeth are not checked until maybe they enter primary school. I think most of us, usually
that's a little
not
bit late.
I think it's a bit late. It's better to get their teeth checked before they enter, before the age of 7, because sometimes the baby teeth too will have decays, and you want to get that treated as soon as possible. not just when they enter. I think because a lot of primary school there's dental therapists or dentists around to check, but before the age of 7, actually it's better to get their teeth checked earlier, not just wait till then.
Yeah, you're right. Like a lot of issues happen because the adult, sorry, what am I saying? The baby teeth grow out by the age of 3.5, 3.5, like that, right? And by the time they reach 7, that's already 3 to 4 years. And if they have oral hygiene habits that are not corrected or diet habits that are not corrected by that point, a lot of times the baby teeth already have decay and that needs fillings and things. So yeah, we do want to try and catch it early if possible.
Yes.
Yeah, and also kids are not so afraid to come to see the dentist. Yeah. I always find that when they come earlier, they're always going to be nervous the first 1 to 2 times, but the earlier they are when they come, or the younger they are when they come, they adapt faster, right? I feel like the 6-year-old who's never seen a dentist before is more likely to be fearful than a 3 or 4-year-old who's seen a dentist twice. Yeah. I think maybe should we wrap things up? Okay. So I think pretty much in summary, regular dental reviews are really important for kids, starting from the age of 1 onwards, all the way to their teenagers and into their adulthood, and seeing both or either dental oral health therapists or dentists are very, very useful. Both dentists and oral health therapists are very equipped with being able to help monitor your kids' oral hygiene habits, their dietary habits, and also their growth and development of both their baby teeth and their adult teeth. And dentists and oral health therapists do work very closely with each other, especially in a clinic like ours where we have both and we're able to communicate, share information very easily.
Yeah.
So I think usually what happens is that, if I'm seeing someone quite regularly and everything is pretty good, I'm very comfortable having Nur Raudhah, our oral health therapist, be the one doing the follow-ups. And I know that if there's anything that she needs to refer or ask questions about, I'm always just 2 doors away or something, Yeah. So yeah. Do you have anything to add?
Also, confidence in the smiles of the kids. I think if in an early age they get their teeth checked, I think they'll feel, they know that they are equipped with the knowledge that, okay, they need to brush their teeth, and brushing teeth or getting their teeth checked by a dentist will actually help make them feel better, hygiene-wise, or even when they speak or talk to their friends, if their teeth is clean, they actually feel a bit much better. Yeah.
You're right. Yeah, actually, nowadays, sometimes when after I do cleaning, I show them in the mirror, like, do you like your teeth better now? A bit wider? Most of the times they go, yes. And I ask them, do you like it? They're like, yes. So do we want to make sure we're brushing at home properly? Like, yes. So, I love working with kids. I feel like they're the best age group to try and set things right with. Because once we have healthy kids, they grow up into healthy adults. Yeah, hopefully.
Yeah.
Great. Thanks for listening to us chat.
Thanks for listening.
I hope we gave you a little bit more insight into kids and dentistry and also what oral health therapists do. And if ever you have any questions about your kids' health, I think it's always important to consult a professional. And we hope to see you. Bye.